A new virus is spreading globally. It is called HMPV, which stands for human metapneumovirus. This virus has been causing concern among health officials and the general public alike. HMPV is a respiratory virus that can cause severe illness, especially in young children, the elderly, and those with weakened immune systems. It is similar to other respiratory viruses like RSV and influenza. China and the USA are seeing a surge in cases. Hospitals in these countries are experiencing an influx of patients presenting with symptoms such as fever, cough, and difficulty breathing. Hospitals are filling up with sick patients, putting a strain on healthcare systems. Medical staff are working tirelessly to care for those affected and to prevent further spread of the virus. Many people are worried about this new threat. HMPV is highly contagious and can spread rapidly in communities. Public health officials are urging people to take precautions such as wearing masks and practicing good hygiene. It spreads through coughs and sneezes, making it easy to transmit in crowded places. People are advised to cover their mouths and noses when coughing or sneezing to reduce the risk of transmission. The virus can also live on surfaces, which means it can be picked up by touching contaminated objects and then touching the face. Regular hand washing and disinfecting surfaces are crucial in preventing the spread. Scientists are working hard to understand HMPV. They are conducting research to learn more about how the virus spreads, its effects on the human body, and potential treatments or vaccines. They want to find ways to stop its spread. By studying the virus in detail, researchers hope to develop effective strategies to combat HMPV and protect public health. HMPV is a respiratory virus. This means it affects the lungs and breathing. It can cause a range of symptoms. Some people have mild symptoms like a cold. Others experience more severe illness. Common HMPV symptoms include cough, runny nose, and fever. Some people also get a sore throat, headache, and muscle aches. In severe cases, HMPV can cause pneumonia and bronchiolitis. These are serious lung infections. Scientists are still trying to understand why HMPV cases are surging. This virus, known as human metapneumovirus, has been around for a while, but the recent spike in cases has puzzled many experts. They are delving into various factors that could be contributing to this sudden increase. One reason could be the easing of COVID-19 restrictions. As people return to their normal routines, they are gathering in large numbers again. Crowded places like shopping malls, concerts, and public events have become common once more, providing the perfect environment for viruses to spread. During the pandemic, people were social distancing and wearing masks. These measures were highly effective in reducing the transmission of not just COVID-19 but other respiratory viruses as well. The absence of these precautions now means that viruses have fewer barriers to overcome. These measures help to prevent the spread of many viruses, including HMPV. Regular hand sanitization, wearing PPE, and maintaining physical distance were all part of a collective effort to curb the spread of infections. With these practices no longer in widespread use, the protective shield has weakened. Now that these restrictions have been lifted, HMPV is spreading more easily. Urban areas in particular are seeing a rise in cases as people commute and interact closely without the previous safety measures. Public transportation and other crowded settings are hotspots for transmission. Another reason for the surge could be a lack of immunity. Unlike more well-known viruses, HMPV has not been a major focus of vaccination efforts. This means that a large portion of the population remains susceptible to infection. HMPV is a relatively new virus. It was first identified in the early 2000s, and since then, it has been the subject of ongoing research. Scientists are still learning about its behavior, transmission, and impact on human health. This means that most people have not been exposed to it before and do not have immunity. As a result, the virus can spread rapidly through communities, especially in the absence of widespread preventive measures. The current surge is a reminder of the importance of continued vigilance and research. There is no vaccine for HMPV yet. This virus, known as human metapneumovirus, can cause respiratory infections, especially in young children, the elderly, and those with weakened immune systems. Scientists are working on developing one, but it will take time. The process of creating a vaccine involves rigorous testing and trials to ensure its safety and effectiveness. However, there are things you can do to protect yourself and others. Simple everyday actions can make a significant difference in reducing the spread of the virus. Wash your hands frequently with soap and water. This is one of the most effective ways to remove germs, avoid getting sick, and prevent the spread of germs to others. If soap and water are not available, use an alcohol-based hand sanitizer. Hand sanitizers can quickly reduce the number of germs on hands in many situations. Cover your mouth and nose when you cough or sneeze. Use a tissue or your elbow to prevent the spread of droplets that can carry the virus. Avoid close contact with people who are sick. Maintaining a safe distance from those who are ill can help you avoid catching the virus. Clean and disinfect frequently touched surfaces. Regularly cleaning objects and surfaces that are often touched can help prevent the spread of the virus. If you have any symptoms of HMPV, see a doctor. Symptoms can include cough, fever, and difficulty breathing, and early medical intervention is crucial. Early diagnosis and treatment can help to prevent serious complications. By taking these precautions and seeking timely medical advice, you can help protect yourself and those around you from HMPV.